Hi, I'm Kari Walker. I'm the Director of Education from the Alzheimer's Orange County, and we can be a resource for you to work with your patients with memory loss. We're a nonprofit organization dedicated to providing free education, support, and services to families coping with memory loss. Having a patient with memory loss presents some unique challenges, as you may have suspected. Sometimes patients aren't accurately able to identify symptoms they have. They can't identify maybe any symptoms at all, or at some point they may be unable to verbally communicate what is the matter. The key to success, therefore, is working with their caregivers. Unfortunately, caregivers are not bulletproof, and they are also affected by the stress and depression from caregiving. Therefore, you need to consider that you're working with a team and not an individual when you're working with a family affected by memory loss. So why is it so important to consider the caregiver? Without a doubt, caregiving is a life-changing event and a huge risk factor for caregiver depression. A conservative estimate reports that 20% of family caregivers suffer from depression. This is twice the rate of the general population. In general, women caregivers experience depression at a higher rate than men, but keep in mind that men will more often self-treat their depressive symptoms with alcohol, overwork, etc. So screening for depression in male caregivers should always be considered. Caregiver depression and perceived burden are indirectly proportional to the care receiver's functional status. As a person is able to do less for themselves, their caregivers' stress increases. 30 to 40% of dementia care partners suffer from depression and emotional stress, and the effects are lingering, as evidenced by a study that found that 41% of former care partners of a spouse with Alzheimer's disease experienced mild to severe depression up to 3 years after their spouse had passed. Chronic stress associated with caregiving results in a detriment to both physical and psychological health. However, a recent study found that the emotional toll is generally higher than the physical toll. The study concluded that the outcome of physical well-being of caregivers was closely associated with the care recipient's level of care required. For example, caregivers of those who need an intense amount of supervision, such as for safety purposes, and who had a high level of functional disabilities, behavioral issues, and cognitive deficits, experienced negative physical health outcomes. Another factor that was identified as a major influence on physical well-being was whether the caregiver was living full-time with a person with Alzheimer's disease. The National Alzheimer's 2017 Alzheimer's Disease Facts and Figures report stated that more than 1 out of 3, that's about 35%, caregivers for people with Alzheimer's or another related dementia reported that their health had gotten worse due to care responsibilities, compared with about 1 out of 5, or 19%, of caregivers for older people without dementia. Caregivers need to feel as though they are in a partnership with their loved ones' healthcare providers. Physicians can play a vital role in making both the patient and the caregiver feel heard and included. Obviously, it's critical to get accurate information about what is happening with the patient, yet in many cases, the patient is simply unable to answer the questions accurately. During office visits, the physician can set the tone and demonstrate respect for the Alzheimer's patient by stating that they are there to help them maintain their memory, and then asking them permission to talk with their partner about what they have observed. Maintain eye contact with both patient and caregiver and speak slowly and clearly, avoiding medical jargon. When treating patients with dementia, remember to keep in mind the strain that their primary caregivers are dealing with. As previously stated, many caregivers become severely compromised from the toll of caregiving. Help them to stay organized and be able to make the most of doctor's visits by suggesting the use of helpful tools, such as a care log to track changes between visits, a medication log, and a notepad to track top concerns and questions. Caregivers must be reminded and reinforced about self-care measures in order to continue providing quality care for their loved one. Local community organizations such as Alzheimer's Orange County can provide referrals for respite as well as opportunities for support and education and someone to talk to 24 hours a day. Caregivers are often hampered in their ability to speak candidly with the physician when the patient is present. Therefore, it's helpful for caregivers to be able to share information utilizing other channels. Handing off a care log for the doctor to read is just such an example of communicating in a way that does not offend or upset the patient. Is it possible for caregivers to leave a private voicemail, or may they email you about a concern? Try to consider these mechanisms beforehand and offer them to the care team. How do you recognize signs of caregiver burden? Some of the risk factors include being female, low educational attainment, residence with the care recipient, higher number of hours spent caregiving, and isolation. Caregivers experience increased burden as the disease progresses, and particularly when the patient with dementia is experiencing behavioral challenges. It's important to be able to recognize signs of caregiver burden. Some of the risk factors are listed on the slide, including the person's sex, educational level, whether or not they live with the person, and whether or not they're socially isolated. There are numerous scales that you can use to assess this burden. A couple of them are listed above. Once a caregiver burden is recognized, ask the person how they're doing. Upon review of their physical and mental health, treat the depression and make appropriate referrals to counseling, etc., or reach out to community-based organizations such as the Alzheimer's Orange County. Physicians should take the time to ask the caregiver about their home life and their caregiving situation. Sometimes all a caregiver wants to hear is that the doctor understands what he or she is going through. There are so many factors that contribute to increased caregiver burden, including the deterioration of loved ones' mental and physical abilities and dealing with dementia-related behavior. Some of the dementia-related symptoms include wandering, agitation, hoarding, embarrassing conduct, and resistance or non-cooperation, making every day a challenge and even harder for the caregiver to get rest or assistance in providing care. And of course, the more severe the case of dementia, the more likely the caregiver is to experience depression. You may be asking yourself, how is it possible to treat your patient with Alzheimer's disease and the caregiver efficiently, asking them these types of questions within such narrow confines of the typical office visit? Alzheimer's Orange County can be a great partner in this. A direct referral to us translates into 24-hour, 7-day-a-week telephone availability, free caregiver support groups and education classes, consultation with social workers, and so much more. We would love to partner with you in improving the quality of life for your patients and their caregivers. Thank you so much.